call it Obamacare or the Affordable Care Act, health care reform considered a signature accomplishment of the Obama administration, and of course with good reason. For 60 years, presidents of both parties tried and failed to improve health care coverage for Americans. Dr. Sanjay Gupta explains.
In putting his signature on what came to be known as Obamacare, the president did what others had tried to do and failed many times since World War II, starting with Harry Truman.
He wanted to increase the availability of doctors, of hospitals, and have the government serve as a guarantor of insurance for all Americans.
But in Congress, Truman's plan never got so much as a vote.
The American Medical Association, very wealthy, very powerful lobby group, also vehemently campaigned against Truman's health care plans.
We do not want socialized medicine.
In the 1960s, a similar fight. Ronald Reagan, before becoming governor of California, recorded this message: pass Medicare, and the United States would soon become like the communist Soviet Union.
One of these days, you and I are going to spend our sunset years telling our children and our children's children what it once was like in America when men were free.
But Reagan's efforts fell short, and in 1965, President Lyndon Johnson signed the law creating Medicare, health insurance for every American over the age of 65, and Medicaid for the poor. And it wasn't just Democrats. Richard Nixon had big ambitions on health care.
Richard Nixon, which I happen to work for, put forth a very comprehensive plan, which looks a lot in structure like the Obama plan. And then you remember we had a little problem with Watergate, and Nixon resigned, and health insurance totally died.
Thank you, Mr.
By the early 1990s, there was the Clinton plan to cover every American without spending more.
Healthcare reform must be achieved for the good of our country.
Too big, opponents said, too expensive, too complicated.
We're going to lose our doctors. We're not going to be able to make medical choices anymore. It wasn't true, but these kinds of arguments resonated.
Like Truman's plan, it never came to a full vote. Around that time, many Republicans, like House Speaker Newt Gingrich, started talking up something called a mandate, a requirement that every American buy his or her own health coverage.
By having a mandate, you could have universal or near universal coverage and still preserve the private insurance system. So the idea of a mandate was a Republican idea.
By 2008, Hillary Clinton, now running for president, was pushing the mandate herself.
I cannot stress to you how passionately I feel about fighting for universal health care.
As she ran against the young Senator Barack Obama. Back then, though, candidate Obama was against it.
Senator Clinton says, I'm going to make universal health care by mandating that everybody buy it. But if people can't afford it, it doesn't matter what the mandate is, they're not going to buy it.
But by election time, he had come around to Clinton's position. And now, Obamacare will likely rise or fall on that very pillar. Dr. Sanjay Gupta, CNN, reporting.
And the Supreme Court is expected to issue a ruling on the Affordable Health Care Act. That is happening this Thursday.